So hello everyone, welcome to my another video. So today we'll be discussing about the disease achalasia. So what is this achalasia? So let's have a look. So the first point mentions that it is the inability of the lower esophageal sphincter to relax during swallowing and loss of peristalsis in distal 2/3 part of esophagus and thus the absence of esophageal peristalsis. I repeat, the inability of the lower esophageal sphincter to relax during swallowing and the loss of peristalsis in distal 2/3 part of esophagus and thus there is absence of esophageal peristalsis. So what are the causes? So generally the degeneration of inhibitory neurons of myenteric plexus leads to impaired relaxation of the lower esophageal sphincter. Though the actual cause is unknown till now, but it is estimated that the degeneration of the inhibitory neurons of myenteric plexus leads to this problem. And the male to female ratio of this disease is about 1:1. The ages include 25 to 60 years of age. So please have a note of it. So now let's look at the symptoms. The first symptom mentioned over here is dysphagia, that is difficulty in swallowing, and this is the most common symptom. Okay, so it is seen in around 80 to 100% of the cases. Then chest pain, then regurgitation of undigested food, weight loss and nocturnal cough. One more important point to mention over here, that heartburn may be present in patients with achalasia and thus patients are frequently misdiagnosed with GERD, that is gastroesophageal reflux diseases, and treated with PPIs. So please keep this point in mind. Barium swallow test is the best initial test associated with achalasia. So in this test patients are allowed to swallow a thick mix of barium before X-ray, and then X-rays are performed and X-ray shows bird's beak appearance. Now let's look at the radiological stages of achalasia. Means upon the X-rays how many stages are being diagnosed after looking into the X-ray. So stage 1, when the esophageal diameter is less than 4 cm, it is termed as stage 1. It is grouped under stage 1 achalasia. When the esophageal diameter is around 4 to 6 cm, it is categorized or grouped under stage 2 achalasia. If the size of the esophageal diameter is greater than or equal to 6 cm, it is grouped under stage 3 and stage 4 achalasia. The size is same in case of stage 3 and stage 4 achalasia, but only difference is that in case of stage 4 achalasia, the esophageal shape becomes sigmoid. So please keep this point in mind, that in case of stage 4 achalasia, the esophageal diameter is greater than or equal to 6 cm, but the esophageal shape changes to sigmoid. So these are the radiological appearances on barium swallow of different stages of achalasia. So at the X-ray A, you can see the stage 1 achalasia. At the X-ray B, you can see the stage 2 achalasia. At X-ray C, the stage 3, and at the X-ray D, you can see the stage 4 achalasia. So out of these 4, which one shows a sigmoid shape of the esophagus? Can you mark it out? Yes, the option D. The X-ray D shows the sigmoid shape of esophagus, and hence it marks the stage 4 achalasia. So I hope it is clear. So now let's look at the most accurate test associated with achalasia. So manometry is the most accurate test over here. So what is manometry? So manometry measures the strength and coordination of esophageal contractions when an individual swallows. I repeat, manometry measures strength and coordination of esophageal contractions when an individual swallows. Then EGD. What is this EGD? It is esophagogastroduodenoscopy. I repeat, EGD stands for esophagogastroduodenoscopy. And what is this technique used for? So this technique of EGD is used to rule out the obstruction or cancer if the duration of symptoms cross 6 months or there is blood in the stool present. So this EGD is done if there is blood in the stool or the duration of the symptoms exceeds 6 months. Then it is used to rule out the obstructions related cases. So I hope it is clear. So now moving to the treatment section. So what is the best treatment associated with this disease? So the first, the Heller laparoscopic myotomy. It is the surgical procedure. I repeat, the surgical procedure include Heller laparoscopic myotomy, and other treatments include sublingual nitrates, CCBs, that is calcium channel blockers. So calcium channel blockers can be used to decrease the lower esophageal sphincter pressure, but both are not so much effective actually. Means the sublingual nitrates as well as the CCBs, they are not actually so much effective in case to treat the disease of achalasia. And the last treatment, that is botulinum toxin injection into the lower esophageal sphincter. I hope the treatment section is also clear to you, and in the next video we'll be solving a case study related to achalasia. So till then, please revise this video for once, and I will be uploading the video tomorrow. So till then, bye, see you.